Hello friends, I'm Dr. Arundhati Sidhaye, Cataract and Refractive Eye Surgeon at Vision Eye Center, Pune. So today I'm going to tell you how, with the help of advanced technology and by your choice of lens, we make you spectacle free after cataract surgery. You must have seen many of your friends or your relative who undergo cataract extraction, but they again end up wearing glasses. But in our center, we use very advanced medical equipment because of that, and with the help of high advances in technology of lenses, we can give you spectacle free vision. For that, how do we do that, and how you have to help yourself to choose this technology and these lenses, and then you can be spectacle free at any age after cataract operation. For that, I'm going to tell you a little bit about the cataract and then about the technology. So the first thing is cataract usually is an aging change. So I'll show you a small poster in which you can see how this is the section of the eye, anatomy of the eye. This is the cornea, that is this portion, the black portion that you see. It's like a watch glass. After that is the iris, and here you can see a rounded structure, and that is the natural lens. This is our retina. You can see the blood vessels going on the retina, and this is the optic nerve. So whenever the light comes from this area, that is from the outside of the eye, it enters the eye, and because of this cornea and this lens, it gets focus of the retina, and then the optic nerve, through the optic nerve pathway, it reaches the brain, and we come to know that we can see this image. Okay, what happens in cataract is, like, this lens, because of the age, it becomes slightly cloudy, and that is what cataract is. It is not a disease, it's an aging change. So for simplifying the matters, I'm showing you a model of the eye. Now see, this is a model of the eye in which you can see the cornea, the uppermost portion, then this is the retina, this is the optic nerve. Now if you keep your eye like this is the portion where the natural lens is, okay, and whatever rays are coming from this direction, because of the cornea, this portion, and the lens over here get focus on the retina, and you can see the image. Naturally the lens is clear like this, okay, but in case of cataract it becomes cloudy like this, and then all the rays cannot overcome this block, and very few rays come to focus on the retina, and that is why the picture that you see is not completely gone. You are not blind, but it is comparatively hazy, or the quality has gone down. This is the right time to take the decision for cataract, because if you let the lens become completely mature like this, completely white, and you cannot see anything that is near also, if you cannot read, that means your lens has become completely mature. After that, the modern operations that we do with the Feko emulsification technique and with the micro incision, without suture, without blood, without eye patch, with all these advanced lenses, is not possible. So whenever your doctor tells you that you have to undergo cataract operation, please do not delay it, because it will become like this, and all the advanced technology that can be used nowadays will not be possible. So first decision is your decision that you have to take in time. Second thing is the equipment that we use. Okay, so the most important part in this operation is we have to put a clear lens here again by operation after removing the cataract from this eye. To remove this cataract from the eye and to place this lens, we require few equipment. Now at our center, we use all international brands that are at present used in all the developed countries like America and UK. So all these international brands which are present in the healthcare system over there right now, the same machinery we have imported, and we are using that in our center. And because of that, we can give you all the advances in eye technology, and you can become spectacle free. So the first machine which is important and used at our center is the one over there. You can see that is ICL Master from Zeiss, Germany. It is a very precise and a very high-end instrument that calculates the lens power by 5 times more accuracy than the normal lens scans that are used elsewhere. So this power calculation of the lens that we are going to implant in your eye has to be very, very precise. Now, if you see, I'll show you the scan from that machine. You can see we see the scan from both eyes at one time. We compare the axial length and we take measurements of all lenses so that whatever you choose, we can order the lens precisely. This is one of the factor because of which we can make you spectacle free. This machine is imported from Carl Zeiss, very precise, very expensive. That is why all centers do not have it, but we are using that to make you spectacle free. This is the main reason. The second reason I'll tell you, the second thing is the Feko machine that we use. Now this machine is very important in helping take out the cataract. Now this cataract, if it is like this, okay, it is this big, we cannot take it out through the eye like this, okay, and take a big cut and give sutures. We do not do that. What we do is we introduce a Feko machine from a small incision in the eye. The incision is 1.5 millimeter to 2 millimeter, very, very small, like an injection. It is as small as that. After that, from that incision, we put a Feko probe inside the eye. What the Feko machine does is like it liquefies the cataract and then it sucks it out from the eye. That is why through a 1 millimeter, 2 millimeter incision, all the big cataract, which is as big as 9 to 10 millimeters, can be taken out through 1 millimeter. For that, the cataract has to be soft. That is why I told you in the very first place that you have to go and undergo cataract operation as soon as your doctor tells you. Now the preciseness of this instrument, that is the Feko machine, is also very, very important. The more precise, the more accurate, the more advanced this machine is, it is more and more expensive. The machine that we use at our center is from Johnson & Johnson, America. This machine, which is called its intuitive Feko machine, is very precise. It is cold Feko. That means whatever energy we use in the eye do not get dissipated in the eye, and that is why next day, within 24 hours, you can gain 99% of your vision. The cornea, there is no edema on the cornea. The cornea is clear just because of this machine. Second thing what this machine does is it is very, very precise. It is very, very fast, and it has got a great safety value. Like when we go to buy the car, we see whether the car has airbags. The machine similarly has very, very safety values, and because of that, I can do your cataract very fast. That is like very few minutes, and it is very safe, yet it is safe and very precise. Now, because this machine is very fast, in our center, we do not give injection before the cataract, so it is not painful. Because the incision is very small, we do not give any suture. In fact, because of that also, the eye is very comfortable. And because this is a high-end machine, you do not get any eye pain or any swelling in the eye. So next day, if you see your eye, you will not even realize that it has been operated one day before. So this is the second technology which is used at present in all the advanced country, and we have imported the same equipment, and that is why we are able to give you a spectacle-free lifestyle. The third thing that we do is the instruments that we use in our operations. All the blades used are of imported quality and they are disposable. We use only one blade for one person. We do not reuse that blade, and because of that, any astigmatism or any number that is introduced during the surgery is not introduced at our place, and that is why the spectacle-free cataract operation is possible at our center. Now the fourth thing that is important is your decision regarding the lenses. I'll show you there are two types of lenses. One is a monofocal lens. It is like this. This is a model, and because of that it is very big. In fact, the actual lens is only 5 millimeters. So this is a model. I'm just trying to show you how it is. So this part is the optical part from where you can see this is a monofocal lens. That means with this lens you can be spectacle free for distance. For reading you will require glasses. Then there is another lens which is called as multifocal lens. You can see multiple rings on this lens. Because of that, it has got multiple focus, and you can see distance, intermediate, as well as near. And you can be completely spectacle free. So all the expenses which are born later, like going ahead with the spectacle correction again and again, making new glasses, progressive glasses, bifocal glasses, the problem that comes with these glasses, like you cannot see clearly, or the vision is hampered because of the optical illusions, the scratches on the glasses, everything is avoided if you use this multifocal lens. Now the decision is not as simple as that. It also includes some other things, like if this is your spectacle correction, which we do in the start of the surgery, you can see over here, any person, if he has only spherical power, then you can use a monofocal lens, you can be spectacle free. But if you have this cylindrical power in your spectacle correction along with the axis, then you cannot use spherical lenses. With the help of spherical lens, you will not become spectacle free. Then you have to use a lens like this, which has an axis on it and has a special measurement for the axis, which is calculated by the latest Barrett's calculation, and we can put a toric lens in your eye, which will make you spectacle free even if you have axis number, cylindrical number in axis. So if you use a monofocal toric lens, you will become spectacle free for distance. If you use a multifocal toric lens, then you will become spectacle free for distance as well as near, and even the toricity, that is the number in the axis, will also completely disappear. So these are the ways by which you can become spectacle free. These are the recent advances. These are the things that are done in the developed countries. We have the same technology, the same option. All these implants are Indian imported, and all the technology that is used over there, we are using it in our center to make you spectacle free. Please feel free to ask any questions. Subscribe to our channel and know more about these surgeries. Next, I'm going to post also one video of how we do cataract surgery. Actually, I have that recorded, and I'll post that also in the next episode. Thank you. Choose correct, choose wisely, and be aware of the recent technology and where it is available, and only then take a decision of your cataract surgery. Be spectacle free at any age. Thank you.